Good evening to everyone and welcome to today's session. Yesterday, you all had a wonderful quiz tournament in the evening. Even today evening also, you had a wonderful game. But yesterday, I could not get time to discuss the 50 questions. So today, we are going to finish the yesterday's 50 questions. And today's 50 questions, we will discuss it tomorrow evening. Okay, so every day, let us consolidate the preparation. Evening, playing about 50 questions and having a live discussion with Dr. Murali. And slowly over a period of time, we will finish. There are almost all 20,000 MCQs covering the 19 subjects from the past 15 years of All India AIMS, PGI, JIPMA. Topic-wise, we will do a live revision. All these are free sessions. So please take every opportunity to tell your friends to join the session, right? So, shuru karenge tam bola. So, doctor, so if you recall the yesterday's evening quiz, I hope a good number of you have participated in the yesterday's quiz. So Muhammad Saeed said, yes. Okay. So about the case control study, it is quick. That's right. You cannot calculate incidence. It proceeds from the effect to cause. That is also right. But incidence you can't calculate in the case control study is what you have to remember. Incidence means you need to know new cases. Case control starts after the person became case and you are going back in the history. Whereas in cohort study, a person who is not yet become a case, not yet a diabetic, for example, you are following him over a period of time in a case of cohort study. So new cases can be identified. So that is the reason cohort can be able to discover the incidence, but not the case control is what you need to remember. Thank you, Manasvi. Sir, Incus app, how is it coming up? Excellent. Last 3 nights were sleepless for me, sitting with my development team, doing testing of the app thoroughly. And in fact, both the iOS and Google, the Android, both the things we are looking forward to launch on September 2nd. So just a little more patience. We are going to have it. Every half an hour, you are going to have a quiz tournament of 20 questions. Starting from morning 8 a.m. to evening 12 p.m. Every half an hour to 1 hour, just like a metro rail, you are going to have the Incus a quiz tournament. And also I'm connecting with a lot of teachers who love to prepare questions and start tournaments on our Incus app. So it is not only Incus offering the tournaments, even individual teachers, I'm connecting them to contribute questions and start the tournament. That way, it become a lot of user-uploaded quiz tournaments. Of course, for the teachers, by conducting tournament, the advantage that they get is they get an opportunity to get connected with the students, and that way they can get a subscription of the students into their private online tutoring sessions. So Incus is going to be a platform for any teacher who want to connect with the students. And for the students, Incus is going to be the platform to keep their preparation alive by competing with all the friends playing every half an hour and getting the analytic report on how their performance was. So with that, let us look forward by September 2nd, at most by Teachers' Day. Let us put September 5th as a deadline to see the Incus app in the Play Store. So look forward. Good to see Pavan Gupta. Anmol is saying, sir, is there any group for questions discussion? Definitely, Anmol. We have a wonderful WhatsApp group, 9000-868-356. Please join, call this number, join our WhatsApp study group. We keep posting every 10-15 minutes a question and students keep doing the discussion. Please be part of it. So now, incidence of a disease is measured by, of course, cohort study. Now, attributable risk. Attributable risk, how do you calculate attributable risk? It is also called the risk difference. The disease among the exposed and disease among the unexposed. How much difference is there? Based on that, you will know whether can I be able to attribute the risk or not. You will be able to do, and that can only happen in case of a cohort study. Cohort study is what you need to remember. Now, cohort study incidence can be calculated. So what is odds ratio? Odds ratio is fundamentally a risk ratio in case of case control trials. So it is like a relative risk in cohort study is similar to odds ratio in case control trial is what you need to remember. Now the study of the alcohol intake for 10 years and occurring of the hepatic disease. It is an example of a cohort study. Once more, types of clinical trials is the favorite topic of the examiner. So in a double-blind clinical drug trial, what is meant by double-blinding? The patients do not know which treatment that they are receiving, whether they are receiving placebo or the actual drug. The patient doesn't know. Even the researcher also doesn't know whether a patient is going into the placebo group or the drug group, is what you need to remember. Now, in randomized control trials, the baseline characteristics of the intervention are similar in both the arms. So one placebo group is there, one drug under investigation group is there. In both of them, age and certain parameters are all similar. The investigator bias is minimized. That is the whole purpose of the double blinding. And the sample size for you to calculate in a randomized control trial, it all depends on the hypothesis. So these are the points that you need to appreciate. Now, what is the purpose of a control group in an experimental study? Control group helps to eliminate the alternative explanations for the results of the study. That is the purpose of taking a control group in an experimental study. And why do we do randomization? Randomization is basically done to equalize the effects of the various external factors so that you can be able to remove the bias, which is the main purpose. A pharmaceutical company develops a new antihypertensive. So don't be angry on me that I'm going relatively faster. I have 20,000 questions to finish doing revision. Only those questions where there is an analysis required. I'll try to go a little more deeper. Otherwise, we will run through them. And please don't forget before joining the discussion, take every opportunity, evening 6:30 p.m., like a clock, our online quiz will start. Wherever you are, join that. You get the quiz link, you can join that, participate, solve the 50 questions in a quiz manner, and then join this discussion. That's how we can make this whole process interesting. So neither the patients nor the treating physicians are aware as to patients are going into which group. This is an example of a randomized controlled clinical trial. Intention to treat analysis का मतलब क्या होता है, and why do we do that? Typically in randomized controlled trials, we do intention to treat analysis. So what is the meaning of intention to treat? It is also called effectiveness analysis, method effectiveness analysis. You compare the outcome according to the randomized group, and adherence to the intervention is not necessary. So in this, the randomization is maintained, treatment assignment is based on chance alone, so no worries, no bias is there. And the randomization provides all the required foundation to calculate the statistical test of significance. All those advantages are there in intention to treat analysis. The only thing is, intention to treat analysis does not take into account the violation of the trial protocol. So while you are doing the analysis, you will include all the randomized patients in the groups in which they are randomly assigned, regardless whether they have adhered to the entry criteria, regardless of the treatment they received, regardless of their withdrawal from the treatment or the deviation from the protocol, or whether they are dropouts. Regardless of all that, when you do analysis of a randomized controlled trial on the participants, then it is called intention to treat analysis, is what you need to remember. Randomization में random का मतलब क्या होता है? Random is equal and a known chance. Equal and a known chance is a random. The major purpose of the random assignment, what is that? It will ensure that the study groups are comparable, whether people are going into placebo or whether they are going into the treatment group. They both are comparable in the baseline characters, so that heterogeneity of the baseline characters will not affect the outcome. So that is the main purpose of random assignment. Tomorrow when you do post-graduation, you need to submit a thesis, you need to do a dissertation, right? At that time, all these things are going to come. A little dry subject, thoda preventive medicine, very abstract thinking, but it is ultimately when you become a top consultant, DM में कार्डियोलॉजिस्ट बन गया, कार्डियोलॉजिस्ट के बाप बन गया, बाप बनने के बाद जो भी आप उससे ऊपर क्या पावरफुल पोजीशन होता है, कुछ भी नहीं होता. Are you doing studies? Are you contributing to the research? Are you doing any contribution to the discovery of a new method of prevention, treatment, early diagnosis or anything? That makes you a great cardiologist when you become cardiologist ka baap. Once more, that time we will all boil down to all these studies, etc., etc. Now, regarding the pre-post clinical trial. Pre-post क्या होता है? In this, the patient acts as his own control. Control भी वही patient है और case भी वही patient है. So, before the onset of the disease, you are using him as a control. सेम पेशेंट को एनालिसिस के टाइम में. That's called pre-post clinical trial. So what is the heart of the randomized controlled trial? Randomization itself is the heart of the randomized controlled trial. These are all experimental interventional studies. What are they? Community trial, field trial, randomized control trial. They're all the examples of experimental interventional studies, but not ecological studies. In the last class, I have given you a good pictorial on how do you classify the various studies, right? What are interventional studies, etc., etc. In a controlled trial, to compare two treatments, randomization क्यों करते हम? So what? So that the two groups are similar in the prognostic factors and baseline characters, which is very important for you to draw the inferences from the study. In a randomized clinical trial, what is the main purpose of randomization? Once more, to eliminate the selection bias. About the experimental trial, we can't double blind in animal trials. Is wrong. We can. We can't do interim analysis. They're always prospective. All animal trials are unethical unless cleared. So they're all the two statements. Abhi aa gaya. Very important point that we need to do the revision. Efficacy of a new drug A. A naya drug A aa gaya. This new drug A is compared with the existing drug B in case of the clinical trial phase 3. So you should know, I'm going to take you through the game. What are the various clinical trials? इसके पहले भी हमने इसके बारे में डिस्कशन किया. 1 minute, I'll just get a water bottle. Now, so how do we conduct the drug review? Pehla, animal testing. Then you need to put an investigational new drug application. And phase 1, phase 2, phase 3. Then you need to put new drug application, NDA. Is the formal step asking the Federal Drug Bureau to consider the drug for marketing. FDA reviewers will approve the application or find it either approvable or not approvable. Then post-marketing analysis is called phase 4. About each of these clinical trials, 5 पंक्तियों में आपको characteristic points मुट्ठी में रहना कल के एग्जाम के लिए. चलो, let us expertise. Preclinical evaluation on animals. Why do we do that? To do the pharmacodynamic studies in vivo in animals. To know the absorption, distribution, elimination, kinetics, pharmacokinetics. Then toxicity like acute, subacute, chronic toxicity. And therapeutic index, that is safety and efficacy evaluation. In animals, we do the preclinical. अच्छा, clinical में होता है phase 0, which is the first study in the patient to see how the body metabolizes the drug. Metabolizes the drug. There is a very key word which you should not forget. How does it metabolize the drug? Barabar? Then phase 1. It is a study of small number of patients to evaluate safety and dosing. Safety and dosing. Please don't forget these keywords. Safety and dosing. Metabolism is phase 0. Then phase 3. More number of patients you will do phase 3. Now, phase 3 is done to know the drug effectiveness and further to evaluate the safety. So there is always a gold standard drug, and is it more effective than that, efficacious than that or not? Then phase 3 is the largest trial to confirm the drug is effective, safe, assess the side effects, and most important, compare this drug to the current treatment, right? So gold standard say comparison is done not in phase 2, but in phase 3. Phase 3 में gold से comparison होता है. That is very, very important. So phase 0, it is also called microdosing. Less than 1/100th of the dose of the test substance calculated to provide the pharmacological effect with a maximum dose of less than 100 micrograms. Main pharmacokinetic data, preclinical data, वो सब मिल जाएगा. Then phase 1 is the first stage of testing in humans. 20 to 25 healthy volunteers, 6 to 12 months, anti-cancer drugs and AIDS therapy. Typical examples. The aim of phase 1 is to know the maximum tolerated dose. Maximum tolerated dose of the new treatment. How many types of phase 1 you know? SAD, single ascending dose study. MAD, multiple ascending dose study. And food effect. खाने के साथ अगर दवा ले लिए तो फूड का कुछ इफेक्ट है क्या, वो भी फेज 1 में पता चलेगा. फेज 1 में होता है healthy human volunteers and patient volunteers. Like if you are trying cytotoxic drugs, AIDS therapy, or patients with advanced stage disease, you use patient volunteers. But what are the limitations? The trial is restricted to homogeneous subjects, and performance is extrapolated to heterogeneous marketplace. So, phase 2. Phase 2 में dose efficacy relation, therapeutic dose regime, duration of therapy, frequency of administration, therapeutic window, all these are identified in phase 2. It has 20 to 300 subjects, 6 months to several years. Then phase 2A to know the dosing requirement, phase 2B designed to study the efficacy. So once more, between phase 2A, phase 2B, what is the difference? I leave the literature for you. Then phase 3. Phase 3 होता है therapeutic confirmatory trial. 100 to 3,000 patients, up to 5 years. The drug efficacy, safety, special properties, they're all basically assessed. Once more in this, you have phase 3A, 3B. 3A is before NDA, 3B is after the NDA. Then finally, post-marketing surveillance is called. Phase 4 is what you need to remember. So once more, doctor, phase 1, 2, 3, 4. Every exam that is asked, and you have to be 200% very sure, right? Now, gold standard study क्या होता है for clinical research? Systemic meta-analysis. So, let us say सफदरजंग हॉस्पिटल में एक स्टडी हुआ, हार्वर्ड में एक स्टडी हुआ, इसी के बारे में. You want to know drug A effective on the disease or not? Then इटली में एक स्टडी हुआ. ये पूरा स्टडीज को एक जगह पे लाके अगर आप एनालिसिस करें तो इसको कहते हैं गोल्ड स्टैंडर्ड स्टडी which is systemic meta-analysis, so that even if there is any bias in Safdarjung study, that can be eliminated from the results that came from the Harvard study. So MAT analysis is considered to be the gold standard. So if you look at the various levels of evidence of the inferences you can take from the study, every type of study structure has certain reliability. So of all, meta-analysis has a greater reliability comparatively. Now, about the RCT, randomized control trial. Sample size depends on the type of study. Bias is eliminated by double blinding. Baseline characters are very much comparable. So that is the randomized control trial. And dropouts are included, not excluded. Many times this is the same question repeatedly asked in the entrance exam. So maximum tolerated dose, please don't forget MTD. इसका डिस्कवरी कहाँ होता है भैया? फेज 1 में होता है. That is what you should remember. Selection bias. How can you eliminate? Randomization. So these are all randomized controlled trials. Clinical trials, preventive trials, evaluation of health services, not the before and after comparison studies. So what are the types of randomized controlled trials? Clinical trials, preventive trials, risk factor trials, cessation experiments, trial of ecological agents, and evaluation of health services. So if you want to evaluate treatment, you can do RCT, like chemotherapy, surgical procedure, or any treatment process. Evaluation of prevention, like chemoprophylaxis, immunoprophylaxis, you can do RCT. And evaluation of health programs, healthcare services, patient education programs, administrative strategies, you can do randomized controlled trial is what you need to remember. So randomized controlled trial में randomization क्यों करते हैं? For the selection bias. Now with regard to the randomized control trial, the double blinding mainly to remove the investigator bias. Randomization को बोलते हैं heart of the control trial. The first step in randomized control trial is to draw up a protocol. That is very important. In randomized control trial, randomization is mainly to avoid selection bias. Double blind होता है, both the researcher nor the person knows which group they are entering. The most difficult criteria to establish the causal association, ये ecological factor के वजह से ये disease हो रहा है या नहीं हो रहा है. Most important thing is specificity. Specificity of the association is very important. To establish causation, what is required? To which trial do you do? Randomized control trial. Now, there's an advertisement in a medical journal saying that 2,000 subjects with sore throat are treated. Within 4 days, 94% were asymptomatic, and that the medicine was effective. They are claiming. Can you consider that claim? No, sir, because there is no control, there is no comparison group. So if it is not there, tumi Raja, tumi Mantri, tumi Senadipati. Nahi chalega. So it is incorrect way of drawing the inferences. To know the association between risk factor and disease, ecological study is the weakest study design. Otherwise, case control, cohort, cross-sectional, they're all stronger studies to know the association. To test the association between risk factor and the disease, the best design is cohort study. What is the most essential criteria to establish a causal association? It is the duration of it. It is the temporal relationship. For example, if you want to say by drinking that particular pot water, the person got fever. So most important thing you need to check is drinking from the pot water happened first or fever was first. If the fever was first, later you found he drank water from the pot, then drinking water from the pot is not responsible for fever. So this temporal relationship is an essential criteria to establish the causal relation is what you need to remember. So the most important causal relationship is because of temporality is what you should remember. Suspected cause preceding the observed effect, इसको कहते हैं temporality. Current smokers are at higher risk developing the lung cancer compared to ex-smokers. So the criticality of the causality, how is it satisfied? Reversibility or reversible association. Smoking बंद करे तो कैंसर बंद हो गया, smoking शुरू करे तो कैंसर शुरू हो गया. Then there's great likelihood that smoking is responsible for cancer. High altitude areas में goiter हो रहा है. So what is this an example of? This is called indirect association. High altitude में goiter हो रहा है. But actually high altitude में जो water होता है उसमें आयोडीन कम होता है, उसके वजह से goiter हो रहा है. Not because high altitude has some low partial pressure of oxygen or something blah blah blah, or just because of being in high altitude. So this is an example of an indirect association. By being in high altitude, there is a development of there is a chance of drinking the water containing low amount of iodine, which is responsible for the goiter, is what you should remember. The infections transmitted to the man from the vertebrate animals, इसको बोलते हैं anthropozoonosis, is what you should remember. Endemic क्या होता, pandemic क्या होता? Any condition which is present constantly in a given population होता है endemic. दुनिया भर में एक ही समय पे जा रहे उसको बोलते हैं pandemic. So local endemics or smoldering epidemics, the third type, are called prosdemics. In a haphazard, irregular pattern, if there is a disease happening, इसको बोलते हैं sporadic. Sentinel surveillance, मतलब whatever the missing cases are there, you are bringing them back and adding it to your analytics. That is called sentinel surveillance. From all over the world, HIV found. What is it called? Pandemic. And what is part of sentinel surveillance? It is a method to identify the missing cases, supplement to the notified cases, and to estimate the prevalence in the total population. We use the sentinel surveillance, is what we should remember. So, infectivity क्या होता, virulence क्या होता, pathogenicity क्या होता, और communicability. You should know the definitions. Infectivity is the ability of an infectious agent to invade, multiply in a host. So, pehla, before that cause any effects in the human body, pathogenicity, it should be able to first invade, multiply in a host. That ability of any infection is called infectivity. Like if surface antigen HB EAG is a marker of infectivity. That means If envelope antigen is there, that means there is the organism is rapidly multiplying in the host. Pandemics are all caused by, they're all caused by the influenza A. So Spanish flu, exactly 1 century ago, it was influenza A, H1N1 pandemic, basically. Then 1933 May, they isolated the influenza virus to develop first vaccine. Then 57 में influenza A H2N2 pandemic हुआ, 68 में हुआ H3N2, 2009 में H1N1, 2013 में they found first non-egg based vaccine, and 2018 में they started universal vaccine studies, और हम जी रहा हैं कोरोना के जमाने में. Now, post-exposure vaccination is given in case of rabies. And which disease is infectious even before the onset of symptoms? One of the favorite MCQs in the exam, measles. Measles is infectious even before the onset of the symptoms, is what you need to emphatically remember. So, doctor, with that, we come to the end of today's evening Aapke Farmaish कार्यक्रम. So once more, tomorrow evening we will take up a quick review in the evening, and also in the afternoon we will take the full-scale grand test discussion. Please don't forget your friends to join the afternoon full-scale grand test discussion of NEET PG. Till then, enjoy a great preparation. Thank you.